Hi there, you're welcome to DemiRx Care channel, where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, as a subscription gift to you, we would like for you to download a free meal recipe that we do have here at DemiRx Care. So go ahead and click on the link down below in order to be able to download or view that. Thank you so much for watching and stay tuned. Hey there, so what is our medication today? Our medication today is known as Adapalene. So you've probably seen Adapalene on over the counter with some over the counter items. You've probably seen it used behind the counter. So it used to be a prescription medicine, but it was recently approved to be sold over the counter. And this is a very beneficial medication, most especially in patients who have a serious acne prone skin. So as you probably know, this medication is used in patients who have acne, and this medication works greatly in terms of reducing that acne symptoms or condition that patients have. So good thing that you don't have to take this medication by mouth. So it can be easily applied as a gel, a cream, a lotion, a solution, or a swab. So usually patients are recommended to take this medication by applying a thin film to the affected area once a day at bedtime. So you want to apply this medication at bedtime due to the drying side effect of this medication and due to the medication increasing sun sensitivity. So you definitely want to make sure you're doing it at bedtime and making sure that you're using a good moisturizer as well during the day to kind of help reduce that drying side effect that this medication does have. So which brings me to the side effect of this medication. So the side effect of this medication or topical medication is dry skin. So yes, so it might have a really drying effect on your skin, and some patients may not like this. So that's why it's recommended that you use moisturizer during the day. That way you can keep your skin moisturized. If possible, you can use maybe an ointment based moisturizer to kind of help lock in that moisture, or and also to kind of reduce that drying feeling around your facial area. Also, this medication can cause redness in some patients. It can cause scaly skin. It can also cause burning as well as a warm feeling on the skin. So these are common side effects that patients have reported while taking this medication. It doesn't necessarily apply to everybody, but just in case if it does, these are things to watch out for or look out for. That way you can reach out to your dermatologist and make sure that it is not from the medication, or it is from the medication, or maybe it's just because of the acne condition that you have. Your body is just reacting to it. Also, in terms of acne, it's also recommended that patients kind of identify their what triggers their skin acne. So you want to make sure that you're looking out for what kind of food you eat, making sure that you're drinking plenty of water, staying hydrated as well, because that kind of keep your skin hydrated as well. So the more you drink some warm water, the more your whole body is hydrated, and your skin is not gonna have any drying side effects to it. So you want to make sure, like I said, drinking plenty of water will be great while you're on this medication, as well as using a ointment based moisturizer to help lock in that moisture. All right, so what are some serious side effects that you definitely want to stop this medication once you notice them? So if you notice any bad skin irritation, if you notice any bad swelling, any peeling or itching side effects, or any hives around your face, you definitely want to stop the medication immediately and reach out to your prescriber. You know, tell them, hey, you know, these are what I'm having. Stop the medication, let your skin kind of revive before, you know, starting another topical cream. So you want to make sure that that irritated skin is healed before applying something else that can worsen the irritation. All right. Also, in terms of what to look out for while you're on this medication, if you notice any redness, any swollen or blistering or peeling of the skin, as I said earlier, without fever, you want to make sure that you're reporting to the doctor. And in terms of what to look out for while you're applying this cream or lotion or gel or swab, is you want to make sure that you're applying a sunscreen during the day. So making sure that you're avoiding the sun as much as possible. And as you probably know, even sometimes when the sun is not out, that does not mean that you cannot get sunburn. So depending on the ray, you know, the sun rays, patient can still get sunburn even though the sun is not bright outside. So you definitely want to make sure that, like I said, you're applying some sunscreen on that face before you go out during the day. That way, preferably sunscreen are recommended to be applied like 30 minutes to an hour before you leave. That way the medication, the sunscreen or sunblock can kind of kick in before you go out and about. So also in patients that are taking this medication, you want to make sure that you're avoiding tan beds, as well as during cold temperatures can also increase skin irritation to this medication. So during the cold season, you might notice more irritation in your skin if you do apply Adapalene around this time of the year. Also, in terms of this medication, as I said earlier, this is a topical or skin cream. You don't want to apply it to any place other than your skin. And as a matter of fact, when you're applying this, you want to avoid the corner of your eyes. You want to avoid the angle of your nose. You want to avoid like your mouth angles as well. That way you're not applying it to sensitive areas of your body and kind of causing an irritation on your skin. Also, you don't want to apply this medication if you do have a cut, a scrape, eczema, or any damaged skin. So you want to make sure, like I said, if you have used other medicated creams and you did get an irritation to it, you want to make sure that you let your skin heal completely, preferably, before applying this cream or lotion or gel onto your skin. All right, so before you use this cream, you want to make sure that you're washing your hands before and after. That way you're not applying this medicated cream or lotion into other areas of your body that is not supposed to go. All right. Also, you want to make sure that you're cleaning the affected area or cleaning that acne prone skin before you apply this. And also when you apply it, make sure that it is a thin layer and you're rubbing it gently. So you don't want to go too tough on your skin while you're applying this. And please avoid using any covering or bandages, dressing, or makeup after applying this. So like I said, this is preferably applied at nighttime where you're just kind of going to bed, you're already prepped up. You know, this is the last thing you apply on your face before going to bed. All right. So I hope I was able to help in terms of what to look out for when applying this cream. I hope this works. Like I said, another additional thing that you could do in order to avoid acne is making sure that you're looking out for your trigger foods. Some patients may get acne more when they eat peanuts. I've seen patients say they get acne more when they eat oily foods. So making sure that you're identifying or tracking those foods that you eat in order to kind of, identify them, stay away from them, because if you go that route, you know what's gonna happen. All right, enough of that talk. I hope you were able to enjoy this video. If you do have any further questions, make sure you check our website at www.demiarxcare.com in order to talk to a medication expert or healthcare professional regarding what condition, concerns, or questions that you may have, and we're happy to help you here at DemiRx Care. Thank you so much for watching and stay blessed.